What would you do? Would you tell the clinic supervisor about your mistake?
I think that it's important to consider that this is a difficult situation to make. And if you tell the clinic supervisor perhaps in the wrong way, it could lead to you losing your job and having financial instability for a while. But it's also important to consider that you're putting the patient, you need to put the patient first. And the patient rights are extremely important. So I think you should have documented that you've made a mistake in the patient file or whatever relevant documentation, and I think this should eventually go to a superior. And even though it's a difficult even though it's a difficult decision, I think you should slowly introduce it to your clinic supervisor, and regardless of the gravity of the mistake, talk through the fact that you made a mistake. After all, you're human. You make mistakes. I'm sure your clinic supervisor will accept that and accept the fact that you've acknowledged the mistake, which is a very important principle. Being transparent, honest is more important than covering mistakes for the sake of financial needs in this situation. And I think it's likely that the clinic supervisor will be empathetic. So I think you should be hopeful and tell the clinic supervisor about your mistake in the end.
Thank you. How would you manage the patient? Would you tell him or her about your mistake?
In the situation of being transparent and trustworthy and honest, I think it's important to inform the patient that perhaps inform the patient that a mistake has in fact been made and it has been logged and so forth. I understand the patient might react badly to this, potentially. They might class the clinic as unprofessional, perhaps report the issue even. But I think being transparent with the fact that a mistake has been made at the present moment is more important than allowing that mistake to be made, and perhaps allowing mistakes like that to be made in future. And you'll get more used to it. Other people will get more used to it, and then you'll lose that sense of trust you've been trying to build. And also, the mistake could be more detrimental to your career and both the clinic's prospects in the future if that mistake is left unattended. It needs to be addressed as soon as possible, and that way you can avoid future conflicts.
Very good. What could you have done to help prevent this situation?
Well, one could say you could have prevented making the mistake, but unfortunately, that's unavoidable at this present moment. But I feel what you might be able to do to help prevent making mistakes like that in the future. Obviously, learn from this experience, and perhaps in future have another person in the room, perhaps a chaperone or someone else, or no, sorry, another person in the room who's able to offer much more senior advice, and whom you can rely on to prevent making such mistakes in future.
Do you say no chaperone but senior? Yeah. Okay.
Not a chaperone, but a senior person.
Yeah. Thank you. What are the problems associated with booking too many patients?
Well, there's more disadvantages to the person seeing the patients and there are also some disadvantages to the patients themselves. Now, to the patients themselves, it's likely their time with the medical practitioners are quite limited, and it's important each person gets their allocated slot. But it's also important patients have enough time to explain themselves and explain their conditions and so forth. And also, it can also put a lot of stress on the medical practitioners if they're seeing patients back to back with no breaks. It can be extremely demanding, and this can lead to what's known as burnout per se. If it continues for months on end, it can cause so much stress which accumulates that the medical practitioner's quality of work declines, and essentially they won't be able to provide as beneficial care as they could have. And from observing a GP practice quite recently, I noticed that they did book a lot of patients in a day. However, they had time slots available where they could back another patient's appointment onto that time slot. Break time was separate. However, this time slot was left separate. So if you book too many patients, it's likely that if you have a patient that absolutely requires a longer visit, for example, a mental health consult requires listening to what the patient has to say in detail. So if you don't have that type of session you can back up onto, then it can limit the patient's ability to express what they want and you to provide the treatment they need. And that's the most important aspect of medical practice.
Okay, okay. Last question. If you lost your job, how would you manage the situation and your finances?
Now, this would be a very difficult situation. Once again, now I would try and seek other jobs, perhaps in the area, perhaps in the city, perhaps even a little further away from my accommodation at first. And if I'm unable to do that, I would try and seek financial or social services, perhaps something like Centrelink or a job seeker program like you've seen this year that is able to help you find jobs and also able to help cover your financial needs. So I would seek those if I'm unable to find any jobs at the moment.
Sure. Okay, those are the questions, but you got 1 minute left. Do you want to add anything for those questions?
No, I think that should be fine. Thank you.
Thank you.